Hi, my name is Grace. I live in downtown Phoenix and I'm 30 years old.
My name is Laura. I'm 57 years old and I'm from Kansas City, Missouri.
I'm Emily. I'm 24 years old and I live in Overland Park, Kansas.
I'm Samir and I live in Vancouver. I am 35 years old.
Hi, my name's Steven and I am 46 years old and I reside here in Casper, Wyoming.
Hi, my name is Tia. I'm 40 years old. I live in Seattle, Washington.
I admire companies like Google that are very innovative.
I like Walmart.
Nike.
Tesla.
Costco treats their employees very nicely.
I admire Nordstrom as a company. Their website itself is a perfect example of a usability study if you're going to look at e-commerce.
British Airways.
Target, because of their pricing, their discounts, and their helpful team members.
Anthropologie.
Companies that invest into the people that are their consumers creates a beautiful cycle.
Apple, because they're very good with their customer service and their products are very modern and innovative, but they're sound and they're good.
I like Air Canada. That they make you feel you're noticed, you're part of them, and they make sure that they are doing every step in the way to help you.
I honestly can't think of a healthcare brand that gives me the same kind of really warm feeling in customer service. That feeling of, ironically enough, of really being cared for.
Shopping for healthcare, it's mind-boggling.
Sometimes I don't fully understand what they're offering me or what the price is actually going to be.
I feel like it's a scavenger hunt.
Shopping for healthcare is completely different than shopping for any other kind of service.
It's just all over the place. And it needs a lot of more improvements.
I'm so dependent on other people telling me what I want and what I need. Whereas when I go into a store, I can read and I can get solid facts right there for the price that I'm paying.
Well, healthcare is very different in Canada, as you know. We're not really consuming healthcare here. It's more of like, when we get sick, we just go use our cards and then that's that.
One of my biggest issues is that billing isn't always clear.
I have paid bills and then I get another bill for the bill I just paid. So then I pay that bill and then 6 months later I get a refund check for the bill that I paid, and then I get another bill coming in for the office, but it wasn't for the doctor.
When I've tried to look on my health insurance website to see if I will be covered for something, it's very vague.
Their statements aren't really that transparent.
Like, sure, they can get you into a room. Doesn't mean that the doctor's actually going to see you by then. Sometimes you can be in a room for 3 hours, 4 hours, and be in excruciating pain, and nobody bats an eye.
Everybody talks about, Obamacare this and Obamacare that, and it's making everything better. But then I hear a lot of people talk about that they can't even afford their premiums anymore because the premiums are so high.
I immigrated about 14 years ago from China, and knowing that the healthcare system there, and I was really scared. I don't know what to expect here, but I had such a wonderful experience here.
My healthcare experience is very personalized. I know my doctor by first name, and he takes really good care of me and talks to me as a informed consumer. I think maybe if healthcare companies made it more of a family feel, as in, we're a healthcare company for your family, welcome to our family, we're all in this together, we're all part of one larger family. That might make it a little more, warm.
I think healthcare could learn from other industries in terms of you don't get paid or you don't get rewarded unless the service is done well and properly. The bill gets paid even if the patient is still sick and the illness persists. But in other industries, in big business, that would never happen. If the problem isn't solved, the deal wouldn't close, nothing would happen.